Hello everyone, welcome to our channel. My name is Zetu. I am a registered nurse. Today I would like to talk about heart attack, which is a common serious medical condition that needs immediate medical attention. What is heart attack? Heart attack occurs when the blood flow to a certain part of the heart is cut off. As a result, the heart muscle die in that area due to lack of oxygen and due to lack of nutrients. Coronary arteries supply the heart with blood. What are the causes of heart attack? 1. Coronary artery disease. In coronary artery disease, there is a narrowing and the blockage of the arteries. This narrowing and blockage is caused by arteriosclerosis. And what is arteriosclerosis? Arteriosclerosis is the build-up of cholesterol, fatty deposits, calcium, and other substance inside the coronary artery. And that build-up, we call it a plaque. During heart attack, the plaque ruptures and forms a clot. And as a result of that, there will be a complete blockage of blood flow that results into heart attack, and the heart muscles will also die. Another cause, it happens when the coronary artery goes into severe spasm. During the spasm, it contracts and narrows, and that can lead to heart attack. What are the warning signs of heart attack? Warning signs of heart attack are there not to all the people that have suffered heart attack. Some people can present with no sign, and some people will present with some signs. What are the common warning signs then? 1 is the chest pain. Somebody will feel as if there is a heavy object that is put over her chest. And some people may feel a chest discomfort or the pain that is like squeezing. 2, the pain can be on the jaw, it can be on the back of the neck, it can be on the left arm, or it can be on the back of the shoulder. It all depends on person to person. The third sign is the cold sweat. All of a sudden, someone will develop sweating, and you'll be having beads of sweat all over the face. That will indicate sign of heart attack. Another symptoms, shortness of breath. All of a sudden, someone will be complaining of difficulty in breathing, and you will be gasping for air. Another symptoms is nausea. At times, this nausea is accompanied by vomiting. Another sign will be dizziness, and somebody will be dizzy. That is another sign of heart attack. Heart palpitations is another common sign of heart attack. Once you experience these signs and symptoms either on you or to somebody next to you, please call for an ambulance so that that person will be in the hospital immediately. What is important, do not drive yourself or do not drive that somebody who's experiencing those signs that signal that it can be a heart attack is not safe, because when you try to drive somebody or when you try to drive yourself, the condition can be worsened while you are going to the hospital. It is always wise to call for an ambulance, because the ambulance will come with all the things that can be needed when the condition worsens, and there are professionals in the ambulance that will know what to do. And what are the risk factors of the heart attack? 1, uncontrolled hypertension, diabetes, high cholesterol, age, family history, smoking, high intake of alcohol. There is quite a few of the contributory factors that can lead to heart attack. Once somebody is rushed into the hospital, how they diagnose the heart attack. Therefore, diagnosis of the heart attack. 1, there will be history taking. Secondly, they will do physical examination. They will do ECG. The ECG, well, they will be checking the heart electrical activity. They will do blood works. There is quite a lot of tests that will be done to confirm the diagnosis. Once the diagnosis is confirmed, at that time, that person will be seen by the cardiologist. What is the treatment? The treatment depends on person to person. Some people can be given medication that can dissolve the clot. All that depends on the individual, and it also depends on the cardiologist recommendation. And there are some procedures that can be done immediately, things like cardiac catheterization, where the cardiologist will put a catheter into the coronary artery. They may inject some dye to try to locate exactly where is the blockage. Another procedure that can be done, they may do angioplasty, where they can put a catheter into the coronary artery, and that at the end of that catheter, he has got a balloon. They will inflate the balloon and try to open into the clot or into the plug that is blocking that vessel. Once there is a slight flow of blood into that artery, they may follow up by putting a stent just to keep the vessel open so that it doesn't close again, and they will leave that stent there. It will help to keep the vessel open. There are some other procedure. If the condition is bad, the doctor may even decide to put medication that is going to help that patient at that time, and they will also prepare for an elective surgery where they will do a coronary artery bypass graft. On coronary artery bypass graft, it's a major cardiac operation where they will be bypassing the blocked areas by using the graft that can be taken from the patient, or they can use the artificial graft. In severe cases, as the time goes on, the other patient may need to do heart transplant, and that is done for severe cases. And those are the things that cannot be done immediately, but the patient needs to be monitored, and the patient will be on drug and make sure that is getting ready for that surgical procedure that may need at a later stage. How can we prevent heart attack? Prevention. What is most important once you had a heart attack is to work hand in hand with your doctor. It's important to follow your regular checkup. If you are hypertensive, medication to control hypertension is important. It must be taken as ordered. High cholesterol medication needs to be taken up as ordered. Diabetes needs to be controlled, and blood glucose levels need to be checked regularly and needs to be monitored. If somebody has been smoking, it is always advisable to stop smoking. A healthy diet to control overweight, because obesity is one of the contributory factor of heart attack. Exercise to keep yourself fit. It is important to change the lifestyle of eating. Make sure that you are involved into regular exercises, swimming, walking, whatever exercise that can be recommended by your doctor to keep all your pre-existing condition under control. It is very important to work hand in hand with the health workers as well as with your physician, and follow all the instruction that will be given to you, because the main aim is to make sure you don't have another heart attack. For today, we will end up here, and next time we'll try to discuss some of the condition that you may suggest. Thank you for watching. Please subscribe if you like these short videos, share and comment. Thank you so much for all the support, and thank you so much for all the love. Till next time, stay safe and stay